An intrathecal pump is an advanced pain therapy used for very refractory pain where all other options have not really been suitable for the patient. It consists of a very thin, small catheter that sits in the fluid around the spinal cord, and it's connected to a little reservoir that contains drug connected to a computer, and that will sit typically in the fatty part of the tummy, underneath the skin. The concept there is that the computer will drive a very small amount of analgesic medication into the fluid around the spinal cord, where it can act directly on the pain receptors of the spinal cord, and it minimises the type of level of blood analgesia that causes side effects in the bloodstream if taken orally. Intrathecal analgesia can be used for a variety of different chronic pain conditions. It can be used for underlying nociceptive or tissue-based pain. It can be used for underlying neuropathic or nerve-based pain, or people who have a combination of both. The important thing is that we've looked at other measures to be tried first, and at the end of the day they found either not to be suitable or not to respond to those measures. The reservoir will have anywhere between 1 month to 6 months worth of medication, so the patient will come back to the pain clinic to have a refilling of the reservoir a couple of times a year. That involves placing a small needle through the skin into the reservoir of the pump and filling it up full of appropriate analgesic medication, which then runs on in a continuous basis to be delivered into the intrathecal space. Intrathecal analgesia can be used in chronic pain not related to cancer. It can also be used to manage progressive cancer pain. So there are two uses for that. The treatment of intrathecal analgesia has been around since the mid-1970s, and despite the progression in other therapies that have their own role to play, we continue to use this today as it continues to have a special role to treat patients in whom nothing else has worked.